we can make a story or a movie here every day from what we see. My name's Sean Rupnarine. I've been here 18 years as a porter. I've always been a porter, started as a porter, and hopefully gonna retire as a porter. Portering is usually moving patients. If you come into emergency, then we bring you to your room. We may bring you to an ultrasound, x-ray. Different things are transported across the hospital, medication, supplies, different machines. So majority of our transfers are patients. Usually, I try to keep things calm. I know people are in pain, dealing with different diseases or different situations. So we get a little bit of everything. Some people are just frustrated from wait times and they get a little aggressive because they want it to keep going or get to the end faster. We have to move them off of our stretcher to an x-ray table or to a CT table. Now, they don't know where they are. We're touching them, we're moving their sheet. They're trying to push people away. We try to tell them to keep their hands on their body. They don't always listen. We might have to tell them numerous times, and the hands keep coming. So I've had to move a hand out of my face or say, "You're okay, we're just here to help you," and we're gonna continue moving them. So, you know, being brown skin, having glasses, I always got picked on when I was a kid, and that was kind of the norm, you know, 4 eyes or calling you whatever name was the name at the time. So being a worker here in the hospital, I walked into a room one day. I remember it was an emergency. I had to bring them either to a floor or to a test. And as soon as they saw me, they're like, "Sorry, sir, we don't want you. We want somebody that's our skin color, lighter skin color." Like I was too dark. They didn't want me around their family, didn't want me touching their family. I don't deserve to be called names or treated badly, especially when I'm here helping you. Coming in, I said my name, "How are you? I'm here for this test or for this transfer." And then I was basically spit on because of my skin color. I know that I'm here to help people, so there's gonna be happy, there's gonna be unhappy. I guess it just kind of hurt my feelings a little bit to have that feeling that I had when I was a kid. You know, there's a lot of talk about Indian people in Canada and brown skin. I get asked, when did I learn English? My English is really good. It's like, I was born here in this hospital. I am Canadian. My mom was a nurse here 43 years in this hospital. And when I tell people that, they were like, "Oh, okay." Like it changes anything that you just said.
Do you think in these instances, if you had reported what had happened, like officially through the channels, do you feel like you would have been supported in that?
I feel I would have, but I'm not sure anything would have been done to that patient. It's not like we can charge them for saying something. There's rude things being said all the time. Like some days in emergency, you'll hear a guy yelling on the far side when you're on the other side, so everybody hears it.
Why do you think that patients take out their anger on the healthcare workers?
They don't have anybody else to take it out on. They're only gonna see the people working in the hospital. If they see somebody sitting at a desk, they think they're slacking. They could be waiting for a report. They could be, you know, on break. We want people to come in, get the treatment, and go home. It's not possible to do it in 1 second. Sometimes it takes hours to get to where you're going, and I'm not sure why you feel this way or what you've been through, but you know, you can't let one situation or person ruin it for the whole group. Racism's everywhere. It's never gonna go away. I know I'm not gonna be everybody's favorite. That's not my intention, but I like to smile and get the job done.